Record. Okay. So welcome everyone to SAMA's first ever journal club. We're very excited to start this initiative, and I appreciate everyone tuning in tonight, and especially Dr. Gvozden, who's going to speak to us tonight about ADHD. We're very excited to have him here today. I'll just say a few words to introduce him. So Dr. Gvozden has been a pediatrician in Maryland for the past 35 years. He was actually born in Brazil, where he completed medical school, and then moved over to Maryland in 1978, where he completed his pediatric residency at Sinai Hospital here in Baltimore. He has expertise in dermatology and attention disorders and is currently on staff at Anne Arundel Medical Center. He's an adjunct professor of pediatrics at the University of Maryland, which is my school, and is also on staff at Johns Hopkins Hospital. So we are very excited to welcome him tonight, and excited to hear him speak to us about ADHD. So if you wouldn't mind saving questions until the end, you can also feel free to drop them in the chat, but we'll address them kind of at the end after his presentation. And I think he has a couple of polling questions as well, which you can also drop into the chat once he asks them.
Okay. Well, thanks for having me, and I feel honored to be here. ADHD is very dear to me because there's so much misinformation and misunderstanding. And especially for you, the young physicians, if it's anything like when we were younger, there was very little training in dermatology and mental health. So I have a feeling that hasn't changed a whole lot in the past few years. I would like to let me share my screen here. Oh my God. Sorry about that. Oh. Can you see my screen?
Yep.
Yep. Okay. Awesome.
Yeah, if you want to just put it, yeah, perfect. Okay.
All right. So glad to be here. You know, there are many preconceived ideas and different understandings about ADHD. I would like to see a feeling for you guys. Tell me how do you feel about the following statements? Those are statements I hear very often from people at a cocktail party to my patients at the office. So if you guys wouldn't mind sending Milena yes, true or false for question number 1. I don't believe in ADHD is a condition manufactured by pharma, of course, to make money, and poorly trained teachers who tend to be not patient with kids and want the perfect kids. I hear that a lot. The other thing I hear, parents are very eager to medicate kids because they don't know how to discipline their kids, or want to get ahead of the pack and get an unfair advantage of other kids. It's question number 3. There are way too many kids treated for ADHD in this country. And giving ADHD drugs might make them more prone to abuse drugs later in life. All right. Do you have any answers for me?
Yeah, I do. So, kind of a mix of both. So for the first question, we had a couple of falses. For the next, we had a mix of both. For the third question, some trues, and then for the last one, this one here we got some false. So
Okay. Most people thought the last one was false.
Yes.
Yeah. Well, ADHD, and for us who are older, this is the way we used to treat kids who have any kind of problems or ADHD or not. It was really a character flaw if they have issues, or poor parenting or bad upbringing. And those kids used to be humiliated, with made fun or get demerits, you name it. So those children did suffer, and they still suffer. So that's the old way. Unfortunately, it's not anymore. Uh, this is, for instance, just as an asylum that my son visited, an old abandoned insane asylum. That those are the diagnosis that people were admitted to this insane asylum, a lunatic asylum here in close to Maryland, and from menstrual trouble to you name it. So that's how much we evolved in terms of mental health. Mental health, it's a big problem. In our office, probably 40% of what I do every day is mental health. Kids are falling apart. They have been falling apart for a long time, and COVID has really created havoc. I didn't know what cutting was 10 years ago. It's hard to see a week where I don't see a teenager cutting or teen suicide, really depressed children. So even you future doctors who might not be doing primary care or anything, you'll be faced with mental health in your family members, friends who are going to ask for your advice, your expertise, how to handle, and especially in Serbia, people are very eager to learn how, because they have very few resources, very few medications. So it's a huge problem around here. There are about 8,000 fully trained child and adolescent psychiatrists in this country. And just to meet the current need, we need 30,000. So, and we are one of the worst countries in the world in terms of mental health, of the advanced countries. This is a little map showing the dark red is where there is an adequate number of child psychiatrists for the population. You can see those are the counties in the United States. The overwhelming majority of the counties in the Midwest don't even have one child psychiatrist. So they're all mostly in the coast, East and West Coast. So this is another, another graph showing the child population is not increasing, child psychiatrists numbers are increasing, but they're still lagging way behind. And besides a shortage of manpower, there is an abundance of misinformation. This is, for instance, an article, it's an op-ed on the New York Times. It's Alan Schwartz, who is I think he won a Nobel Prize for physics, but I think you find that he's an expert in ADHD, and he made this really scathing op-ed, like making people about ADHD. And people, it's New York Times, is respectable, someone who is respectable, but I don't go to the New York Times and write an op-ed on economics, am I right? So, but that's the kind of what people read and get really scared about it. For you guys who in general practice, this is a graph showing a few years ago, there was an article that came showing that children who took antidepressants as SRIs were more likely to have suicidal ideations. And that's not saying suicide attempts, just saying life sucks. I would rather be dead, better off dead than alive. And it was very poorly designed study, but nonetheless, it made the news. And you can see in the first graph, uh, 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 the antidepressant use, with the gray bar is when the article came and made the news, and you can see how the antidepressant use flattened, while the predicted curve was to be going up like it has. And as you can see in the lower graph, how there was a little dip in suicides when this came, and right after the suicide rate went way up because all those depressed kids were taken off medication, and then they're truly killing themselves. So something like that creates a lot of misconceptions and yeah. So ADHD is not a new disease. You know, in 1900, Dr. Steele described the first child with symptoms of ADHD. And as you can see, it had different names and different versions of DSM manual. Right now, we're in the 5th version of DSM manual. And this is very interesting because in 1937, Dr. Bradley used the Benzedrine, which is a stimulant like an amphetamine based, and for a child with ADHD for the first time. So, and we still use basically the same ingredient, just with minor variations. And so that shows you how long we have been using the same medication. So with people who are afraid that medicines are new and then people don't know, there is a tremendous amount of information, science behind to support the safety of medication. Ritalin, which is methylphenidate, came in 1955. So that's how long those medicines have been around. Those two ingredients are still the main medications we use for ADHD. Some of you might wonder why in the world did Dr. Bradley give a kid with ADHD, a hyperactive kid, a stimulant? You know, what was he thinking? You know, kind of interesting. They used to think that ADHD was a brain form of encephalitis. And so they used to do spinal taps on those children to look for signs of encephalitis. And but a lot of those kids had bad headaches post spinal tap. So one of the ways of preventing that kind of headache is to give Benzedrine. And those kids who used to be very hyperactive, when given Benzedrine while they're waiting for the spinal tap, they would be sitting on their parents' lap reading books and were attentive. So he said, oh my goodness, we found something. But it was like a lot of things in medicine, was by chance and good observation. You might hear some of us older people say ADD, ADHD, it's one of the same. There's no more ADD anymore. You can have ADHD and not be hyperactive, but then you're ADHD inattentive type. So this is not that important for you. How do we diagnose ADHD? This is the gold standard. This is called the Vanderbilt Assessment Scale. And it's free, it's non-proprietary. You can make copies, you can give it to patients, you're not infringing copyrights. And it is the gold standard. There are a couple hundred different computerized tests and the fancy tests, but nothing, that's the gold standard that everything is compared to. And there's nothing better than this to screen a child for ADHD. There is an adult version called Adult Rating Scale, which has a little more appropriate for adults, but basically the same questions. As you can see, the first 9 questions here have to deal with being inattentive. And the next 9 questions have to do with being impulsive. So this is a real case, but you can see how significant the inattention and impulsivity is in this child. To have ADHD, as I said, you have to be inattentive and impulsive. Hyperactivity is just a reflection of how impulsive you are. If you are distracted easily and your classmate is making something, you're more likely to want to see it. They want to touch everything. So the more impulsive they are, the more hyperactive they are. So that's why the hyperactivity isn't an optional kind of symptom. When girls have ADHD, 70% of them are not hyperactive. They tend to have mostly the inattentive type of ADHD. Boys is more, 80% of boys who have ADHD are hyperactive. And that's why they get in trouble. There are more behavior problems. Girls tend to be, oh, she's so sweet, but she's such a space cadet kind of thing. Very kind of unfortunately, they end up not getting the attention they deserve. ADHD is a brain disorder. It's a neurobiological disorder. There are many MRI, functional MRI differences in children and adults who have ADHD. And those are some of the differences they have. It's going to be a time in the next 5 to 10 years that we might be able to do an MRI to diagnose ADHD. Fortunately, most cases, my receptionist makes a diagnosis. She says, oh my goodness, do something for that kid. He's tearing the reception room apart. But there are some cases that can be a little confusing and a little gray zone. So an MRI might be a tool we might have in the future. This is an example of functional MRIs for normal controls. And sorry for the fuzziness, and the kids have ADHD. The part of the brain that controls what we call executive function and attention is called the prefrontal cortex. That's a part of the brain that you're using right now. It's between your two lobes in the medial part of the division. And that part of the brain is what you're using right now. I have an accent, it's late at night, the slide is fuzzy. It takes a lot of attention. You really have to use your prefrontal cortex. When you're driving and mindless and you almost miss your exit, your prefrontal cortex tends to be not very active, and you're probably using more your temporal lobes for attention. But kids who have ADHD have lower levels of dopamine in their prefrontal cortex, so they rely a lot on their temporal lobes to compensate for attention, but it's not a very effective way. All right, this is a little idea of the prevalence of ADHD in the United States and in the world. I don't know why India and Ukraine have a really high diagnosis rate. In the United States, probably a very homogeneous population, and the rate of diagnosis is very different. But probably anywhere, the most conservative estimate is at least 7% of children have ADHD. And probably like the more borderline cases, close to 20%. There's a big evolutionary reason why ADHD is not a disease. It's a difference. When 5,000 years ago, we're still not living. We're not living in cities. We lived in tribes and we hunted for survival and gathered. So in a hunter-gatherer society, it is actually beneficial if people have ADHD, The reason why, if you are impulsive, you are a better hunter, even nowadays. So if you see something moving and you throw your arrow, your spear, or you shoot a gun, you're more likely to get dinner. If you're impulsive and you say, there hasn't rained for a long time, the tribe is running out of water, this very impulsive, hyperactive man usually would say, I'm going to go out, find water. Obviously, the cautious women say, don't, it's dangerous, it's going to rain tomorrow. But the guy goes out, maybe he gets killed, but maybe he finds water for the tribe. So it is a beneficial thing for ADHD to exist. Unfortunately, you put a child in front of a boring teacher, a boring subject, and if they cannot concentrate, it is a big problem. For sports, ADHD is very helpful too, especially like soccer, lacrosse, hockey, basketball, those very fluid, they're not rehearsed sports where they move, their impulsivity is very helpful. And kids who have ADHD have a good peripheral vision because they're focusing on everything else besides where the ball is. So that helps them do well in those sports. So I like to always tell parents it's not a disease, a difference, but it becomes handicap. And it's very, there's a very strong genetic factor. Those are some other mental health conditions, panic disorders, schizophrenia. As you can see, ADHD, if you have a child with ADHD, there's an 80% chance that a parent has ADHD. You can see height is very genetic. You can see if you have two tall parents, you're very likely to have a tall child. So that shows you, if you have a parent or two parents with ADHD, there's an excellent chance one of your kids will have ADHD. All right. So the ADHD, there used to be thought that there's 4 times more common in males than females because males tend to be more hyperactive, more noticeable. But the common wisdom now is the prevalence is pretty close. As you can see, in children and adolescents, the prevalence stays about the same. In 4-year-olds, it's a little hard to diagnose ADHD because most 4-year-olds are inattentive anyway. You don't grow out of ADHD. Your inattention is constant from childhood to adulthood. The hyperactivity and the impulsivity, as time progresses, your hyperactivity decreases, your impulsivity decreases. But if you're an ADHD child, you will be an ADHD adult as well, but more just inattentive. So kids and adults have ADHD have serious morbidity. Not treating ADHD is really significant. So here we're looking at teenagers. You can see the pink bars are ADHD kids and the yellow bars are the normal controls. You can see how likely kids who have ADHD are really having some serious, even life-threatening consequences for not being treated. If you look at ADHD later in life, you can see the ADHD is the light blue. So you can see how ADHD young adults are much likely to finish high school, finish college, or even or a postgraduate degree. And this is traffic violations. The gray bar is ADHD, and the controls, you can see the different kinds of traffic violations, how much more prevalent is in ADHD kids. If you are a white-collar worker, you make an average $30,000 a year less than a control. If you are a blue-collar worker, that's about $10,000. But by every metric, you underperform if you have ADHD and you're not treated. ADHD also very seldom comes by itself. There are really what we call comorbidities or coexisting conditions. The most common I personally see is anxiety disorder, closer to 40 to 50%. And there's an evolutionary reason for that. If you are forgetful, if you are more anxious, if you double check or triple check, that really seems to compensate for your ADHD. But kids can be very oppositional. They can have learning disabilities or conduct disorder. So I'd like to take a minute pause. Does anybody want to ask a question, maybe just so I can break the monotony, or any pressing questions right now?
I have plenty of questions.
Oh, okay. You want to wait until the end, or you want to ask now?
I'll wait. No, I mean, I'll wait.
Okay.
Yeah.
All right. So since most of you are not going to be treating ADHD right now, at least, just want you to understand the principle. As I mentioned earlier, we use stimulants for ADHD. There's no sedation. There's no sedatives. The reason kids and adults calm down because now they can focus and they can control their impulses. And this is how the medicines work. As I mentioned, it is the part of the brain, the prefrontal cortex, is more dopamine nerve endings. And you can see this is the sending neuron. Those are the vesicles with dopamine. They have those little channels where the dopamine is excreted into the synapses. And for the dopamine to work, it has to find a receptor in the receiving neuron. What medication does, it blocks this reuptake. It's a very effective system. As soon as the dopamine is released, it gets reuptake. There's a reuptake back into the presynapses. And some of the receptors stay vacant. So if you have low level of dopamine, then you don't have a very good connection. By blocking the reuptake temporarily, and that's what the stimulants do, that's what the green does, there's more dopamine floating around, so every dopamine finds a receptor, so you maximize the impulse. So this is a lot of people say, well, this is what cocaine does. True, it's a stimulant. That's what caffeine does, which is a stimulant. Caffeine increases dopamine. Other things that increase dopamine are alcohol, sex, nicotine. Nicotine is excellent for ADHD, except the half-life is 20 minutes and it causes cancer. So this is a little comparison, for instance, of different levels of dopamine increase. Cocaine, obviously, you can see how a dose of cocaine, how high of a rise it is. Food, sex, alcohol, the rise that stimulants cause, it's about the same level as food. So that's why it's not addictive. You know, like the reason cocaine is so addictive, you have this real high rise in dopamine that creates a lot of stimulation. So your body seeks homeostasis and slows down. So when you stop getting cocaine, you're dragging because your body is underworking and you crave. And addicts don't really seek cocaine to get high anymore. They seek cocaine just to feel good because they feel awful when they're not getting their drug. And if you're addicted to a downer, it's the opposite. when the downer is gone, you are very agitated, because your body is in that kind of stage of homeostasis. But stimulants are not addictive. Prescription stimulants are not addictive, which is really, if you tell that to any parent, they say, really? How is it possible? Because what I hear in the internet and thing, because it's very short acting, it's out of your system in 10 hours. And some of my patients take Monday to Friday for school, don't take it on weekends. It is one medicine you can do that. So, but people really worry because a lot of people who overdose, they have cocaine, opioids, and they also have some Adderall in their system. Certainly, ADHD kids who are unmedicated, the risk of substance abuse doubles because they're impulsive, they make bad decisions, they have low self-esteem because they're underperforming. Perfect setup for drug use. So, and that's one of the questions, like the people say, well, I'm afraid I'm getting. So if you want to protect your child for substance abuse, if they have ADHD, you're doing them a favor by treating them. The other common misconception is that kids are overtreated. There is a mad rush. Yeah, maybe in Montgomery County in Maryland, they might be overtreated, but across the country and the world, in the United States, only 3% of kids are prescribed ADHD. And typically the compliance is very poor. While the most conservative estimate is that 7% of children have ADHD. So there is definitely a huge number of kids. The majority of ADHD kids are not being treated. There's a big cultural divide too. Hispanics, Asians tend to really look at mental health and ADHD as a character flaw, and they really are embarrassed. They don't want to treat, they resist treatment. But if you look across the country, kids are under-medicated and underdosed. This is an incredible study that they did for 2 years. Anybody has done clinical research, to have almost 600 kids that they follow for 14 months. They divided in a group, in several groups. One where they got intensive behavior treatment, the Cadillacs of therapy. One that they got that plus medication, one they got medication alone, and the fourth group are, you have ADHD, go to your pediatrician and see how you do. As you can see, the kids who got just medicine did almost as well that the kids who did the combination therapy and medication. The kids who only got behavior management didn't do as well as medication, and the community care did the worst. So this is one study that really affirmed that if you want to help a child or adult with ADHD, medication is the best choice. It's not the last choice. It's not if everything else fails. There's nothing that helps, not even the best behavior treatment helps as much as medication. This is a little real life example of a kid. This is a mom. The interesting was a girl and her third girl with ADHD. She was kind of laughing, but this is a kid. You can see the dates on the left, 11 through 16. Look at all this doodling on the side, how everything is all over the place. But interesting, it's all correct. She didn't do any mistakes. So this is 16. Look at day 17. A different kid, no doodling, everything neat, because she could focus. This poor soul wasn't being distracted, and she was able to create a beautiful job because she's capable, not because the medicine helped. Just was a tool for her. Prescribing ADHD compliance tends to be poor because adolescents, they think pot, weed, marijuana is safe. They think that's not a problem. Everything else is awful. So they look like a medication uh, as they can resist if you don't treat them early. So this is just confirming what I said. Unmedicated ADHD kids, in this case, are 3 times more likely to have a substance use disorder as adults than the medicated ones, which are very similar to control. Certainly, there's not a protective effect from having ADHD and medicating. But if you're unmedicated, have ADHD, the impulsivity, the poor self-esteem leads to substance abuse. This is another study showing the same data. Probability of substance use disorder in ADHD, the yellow graph versus the red one, which are controls. Controls do level off. ADHD keeps going up. The substance abuse. Same thing. So this is just, now that you know, I encourage you to really read about it and talk and inform your patients, because it can be a game changer in terms of quality of life and success. Celebrities have ADHD. This is David Neeleman, who founded JetBlue, admits having ADHD, a workaholic, can do 10 things at once. But I heard an interview from his wife saying he never remembers her anniversary. I don't think it implied it wasn't a very happy marriage. Obviously, it's very brilliant, but the ADHD could affect his personal life. This is the Virgin Atlantic guy. Also, Bronson, right, prides himself on ADHD. Very successful. This is obvious. Einstein, who I'm sure you all know was married to a Serbian, right, Mileva. And apparently there's a play now that's supposed to be phenomenal called Einstein's Wife. He would get lost walking from Princeton to his house there. And on the day he got married, he lost his keys and he got locked out with his wife. He used to rent a room in a boarding house, and they got locked out on his wedding day because he was so absent-minded. This is certainly not a brilliant person, but this is the founder of Kinko's, also ADHD and dyslexic, and Kinko's. I don't know if they're still around, but that was his nickname because of his kinky hair. Walt Disney, ADHD, definitely. George Bush. This is, what's his name? This is the Kinko. This is Ty Pennington. Michael Phelps is from Maryland. ADHD, impulsive, but his impulsivity got him caught doing bad things. Kids who have ADHD can do what we call hyperfocus. If they do something they like TV, they can watch it for hours or play Legos. And Michael Phelps said he used to zone out and swim miles because he'll be in his ADHD zone. This is interesting. This is kind of appropriate now, but I made this lecture in 2015, I think. And this is before he was even running for presidency. And what really caught my attention, he was already a celebrity. This is the book, The Art of the Deal. Of course, he didn't write the book. The person, Schwartz, is the writer who he met with him every day for about months to write the book. And this is the statement from him. So this is not to criticize Donald Trump, but to show that if you have ADHD, you can be even president of the United States. So this is just a brief overall of the whole thing. So I would like to open for questions. I don't know if you want to go to Milena or Milena or go through me first. It's up to you.
Andrei,
Yeah.
I'm Ivan. Ivan
Oh, yeah,
Aksintin.
Ivan.
Great presentation. Really, I learned a lot.
Okay.
I've been in medicine for a long time, but this is I learned a lot, and obviously a lot of issues, and some of them you opened, some you answered. So the majority of people are diagnosed with their kids, and they remain with ADHD all their life. But are there adults that are then being diagnosed, or they were undiagnosed and they are now 40 years old and they say, well, maybe I have ADHD, maybe I should be on something? Is that
Well, it's pretty interesting because, let me close this. It's pretty interesting because the average age an adult seeks care for ADHD is 39. And you are absolutely right, because those are adults who didn't get divorced, didn't lose, really they compensated well. And I have ADHD, so that's probably where my interest is. And I'm lucky to have married a very organized wife, so that's been life-saving. But the average age is because they get frustrated. I'm passed out for a promotion, or I'm smarter than my friend who parties a lot, but I have to work so much harder in medical school to get the same grade that this person doesn't, because I have a little bit of trouble with short-term memory, which is a problem with ADHD. So I've driven away. ADHD people complain, I spin my wheels. I drive away from home. Did I close the garage door? Drive back, the garage door is closed. Now I'm 10 minutes late. So they just start getting frustrated. Their spouses start complaining. You forgot to pick up the kids on time, or you forgot my anniversary. So they start getting frustrated, and adult practitioners are getting much better about diagnosing and treating adult ADHD. And I treat it actually as a favor. A developer here, very famous, but he was saying, oh my goodness, my wife hates you now because now I'm a workaholic, because I always love my job, but now I'm feeling so productive and so much more better in my game. So you can do well with ADHD without treatment, but ADHD treatment, you can self-medicate with coffee, which is expensive and gives you heartburn, but it works. Coffee works, and that's why Starbucks is everywhere. But yeah, adults
are probably very much underdiagnosed, and a lot of things you describe may be attributed to other things, but obviously, if it is chemical in the prefrontal lobe, maybe adults should be treated with these stimulants. I don't know.
Well, not all, but the ones who feel like they're spinning their wheels, they would benefit in a way. And in the healthcare field, we all kind of, well, not all, but a lot of us want short-term results. We don't have the luxury, like a lot of executive chefs, a lot of doctors are ADHD, because we have the pressure to get it done. We don't have the luxury to procrastinate, because if you have ADHD, if it's boring, you procrastinate. So the chances are all of us have many coworkers who are ADHD that are not, but can be good. Anyway, sorry.
So we have a question in the chat from Dana Mihal. Is there any behavioral therapy that can help young children to focus?
Children, unfortunately, don't have the developmental to learn very well to write notes, to use their iPhone, to you know, to like, you know, have schedules and agendas. They don't have the sophistication, the brain development to do it. So you can create habits, you know, but there's no therapy. They don't have a mental disease. If their self-esteem is in the toilet, then we work. But you can do coaching. You can tell parents to create lists. You know, in the morning, you don't say, just go ready, get ready for school. You say, brush your teeth, brush your teeth, get your backpack ready, get your lunch. For adults, they use their phones or a dry erase board, and they have to have the visual to say, oh my goodness, pick my suit from the cleaners. I know they have to write everything down, or if they go to the grocery store for their spouses and they come back with missing two things because it wasn't on the list. The spouse said, while you're there, could you get me a bag of apples? They'll come back without the apples because it wasn't written. So, so behavioral therapy can help, but certainly not as much as medication, but it's certainly an important part. And if you can afford, because of our shortage of therapists, you know, it's a tall order to find therapy, to find time and therapy and money and affordability. So it's hard. In a perfect world, it would be great.
So Dragan Vujovic in the chat asks, so building off of that, what does the behavioral therapy mentioned in the studies look like?
Those were, they were actually not, they were like experimental classrooms where the kids didn't go to the regular school. They went to regular classroom, experimental classroom. They were staffed by educators, psychologists. They had a lot of communication with the parents, a lot of agendas, notes, and training them to get habits. You know, if you get in the morning, set your clothes, your uniform, and your shoes and your socks in the morning. So that kind of coaching behavior it was.
We have another question in the chat from Dr. Dan Varagic. If ADHD is present at a young age and inattentiveness continues throughout life as hyperactivity or impulsiveness declines, what is a good time to start treatment in your opinion? There must be variability, but what do you think is a good age to start? Is there an age that is too young?
No, it's much harder to diagnose when kids are younger because probably at age 4, for instance, 20% of kids would really fit criteria for ADHD. Have I treated younger kids? Yes, but those are the kids who are over the top. You know, I'm a little careful diagnosing and treating under 5, 6, but I've treated the kids. I mean, those kids are literally climbing the walls. The best age to treat is that until 8, children are very resilient. For those of you who have children, you know, they're not angels, ADHD or not. Some days, yeah, they're really rotten. They go to bed and you wake up next morning still fuming because they were so rotten. And they say, hey, Daddy, are you taking me to Chuck E. Cheese today? I said, you're lucky I didn't kill you last night, you know. And so they're very resilient until 8. After 8, all children, they start internalizing. Well, my mom and dad tell me I'm special, but I'm smart, but how come I got a D? Or how come I got into trouble? How come I let the door open, the dog ran away, you know? So the self-esteem starts suffering. Let's face it, if you're raising a child in Montana, and this kid you're farmers, and the kid is climbing trees, chasing chicken, but really good with a tractor, and you say, well, he's going to be my helper when I'm older. He's going to be a farmer and he's fine. Goes to a one-room school and he does okay. He can do the books for the farm. You're fine. You put the same kid with a family who lives in an apartment in New York City, the mom collects antique Chinese vases and you already broke 2 of those. and this kid is not going to Harvard anymore, those parents already do something. So it's all a matter of degree. So not all ADHD needs to be treated. In a typical suburban family life, like most of us live, it is a problem. But again, when do you treat? When the kid is suffering. It's self-esteem to me. When the self-esteem is a problem, adult or child, without self-esteem, it's a problem.
Great.
Another question in the chat from Ivan. How do you titrate how low the medication dose has to go?
Well, good question. I start everybody, adult, or let's assume if I would treat you even, I would start you the same dosage I start a 6-year-old, because I don't know what your metabolism is like. Are you a fast or slow metabolizer? I have seen kids with bad ADHD who need small dosage, and kids with a severe mild ADHD needs a large dosage. The beauty of ADHD, the benefits are instant. There is no build-up time. You can take ADHD medicine for 3 years. You're not any better than day one. What differs is the metabolism of the person. So we start everybody low, and every few days we adjust the dosage upward until we find a sweet spot, or if they have a side effect. I tell people with ADHD medicine is safer than Tylenol. Tylenol is very safe, but if you overdose on Tylenol, it will destroy your liver. ADHD, you don't get blood work, you don't do EKGs, is extremely safe. Tylenol has no side effects. I've never seen anybody even be allergic to Tylenol or have a stomach upset. ADHD medicine is safe, but has a lot of side effects, especially appetite suppression. Most ADHD kids are very skinny because they're hyperactive. So we have to monitor their weight very carefully, because coffee, if you drink coffee before lunch, you lose your appetite for lunch. Stimulants will do that. They make it up in the evening. Some kids who take ADHD medication get very flat. They get almost too businesslike, and people call them zombies, which is wrong, and that's a problem. That's why ADHD medication gets a bad rap, because some people push their kids to take, and they're really not themselves. And but we do titrate the dosage upward until we find, and people know, oh my goodness, I'm getting so much done. And instead of spinning my wheels and going online and doing some work and getting distracted, it's pretty amazing the difference when you have ADHD and you take medication.
And there is no tachyphylaxis once you hit that dose.
There is not tachyphylaxis. There's not. That's why you can take it for years. If your weight changes up or down, you might need to adjust, but it's going to work as well, especially with amphetamines. It will work as well 5 years from now. Methylphenidate, every 2 years, you might have a teeny bit of tachyphylaxis, but not on a regular basis, because it's so short acting. There's not even time to develop.
So you just started. So I had a question, like, are all the Ritalins the same? I mean, it sounds like it's not all medications are the same.
It is. Methylphenidate is the same methylphenidate.
All of them, whatever the brand name, they are.
What changes the delivery system? Ritalin is just short acting, and we don't use short acting anymore. It's too inconsistent, and there's gaps. They have to go to the nurse to get medicine at lunch, and that's not ideal. So we use extended release methylphenidate, which is 10 to 12 hours. We extended release amphetamine, Vyvanse, Adderall, extended release. But Adderall is plain amphetamine. Now there's some, instead of amphetamine salts, they have pure amphetamine that has a little less side effects, less appetite suppression. So what changes is the delivery system and more purified forms, but basically the same amphetamine from 1937 and the same methylphenidate from 1955.
Right.
Any other questions? We're just coming up to the hour.
Just a quick question. Thanks so much for your talk.
Sure.
For those of us considering like different specialties, can you tell us about kind of your everyday, like 9 to 5? Like, I know 40% of your job is mental health, but how does your typical day look?
Well, it's 40% of my mental health is my day's mental health because I can, because my wife works, we're in the same practice, and so she can see this. It's a luxury I afford myself. Most pediatricians don't and send people out. But independent of that, if it's not in a daily practice, it'll be your family asking you questions about mental health and ADHD. But your question is how my day is like. I like, I'm 67 and have no plans of retiring. I do love what I do. Some days are hard, but I'm a little skeptical of some of the older practitioners telling young physicians, yeah, it sucks, insurance companies, EMR. There's always something, but taking care of people is such an honor and a privilege, and I really encourage you all to really follow your dreams, because you'll be rewarded. If you want to do it to make money or have an easy life, yeah, it's not for you. But I'll tell you, the rewards that you get on a day-to-day basis from people recognizing what you did for them is great. So see a lot of snotty noses, a lot of diarrhea, worried moms, but we see some really interesting cases, some pathology, and yeah, I feel lucky to be a physician. So, and you guys should feel the same.
Thank you.
Thank you.
Sure.
Was great.
Well, great. Thanks. Sorry for the glitches and my accent, and I hope you guys got something out of it.
Yeah, that was awesome. Thank you so
Well,
much.
good luck. I hope to join you at your next one.
Yeah, absolutely. Thank you.
All right.
That was great.
Appreciate it. Thank you. Good night. Good
Laco
night, everybody.
noche.
Laco noche.